To our dear Professor, Dr. Sarah Mulholland, to my fellow classmates, ladies and gentlemen, my name is Anlin Lesko. Tonight, I'll be presenting to you about the post-disaster trauma. Post-disaster trauma is caused by traumatic event. It can be man-made disasters such as school shooting, war, accidents, street violence, and crime, or it can be caused by natural disasters such as storm, hurricane, tornado, earthquake, floods, and fire, according to American Counseling Association 2011. There are adverse effects that trauma can bring, like sleeping problems, nightmares, recollection, sadness, depression, anger, sense of helplessness, physical ailments like headaches, stomach aches, dizziness, then issue of relationship, numbness, then poor eating habit, lack of concentration. Essential strategies and intervention can be applied. First is we have to identify the factor of the victim's insecurities, like having physical discomfort such as feeling hungry, thirsty, or cold, or they might still be in the area where the trauma occurred and in the sight of the attacker, preparing to clean up themselves after a violent encounter. They are still concerned about being attacked again. The second intervention is debriefing, where encourage the participant to share both emotional and factual aspect of their experiences. Then another intervention is cognitive behavior therapy for post-disaster distress, or CBT-PD. It is transdiagnostic, encompasses a wide range of psychological behavior and cognitive reaction to the disaster, including psychosomatic condition, according to Hamblin 2021. There are four elements of this CBT-PD: psychoeducation, debriefing, retraining, behavioral activation, cognitive restructuring. And the skills of the mental health professional for post-disaster trauma. Number one is cross-cutting trauma focus on competencies. Then knowledge competencies, assessment competencies, trauma-informed professionalism, trauma-focused psychological intervention. The intervention approaches that can be counterproductive for post-disaster trauma and should not be done, like psychosocial intervention, should have psychosocial intervention and not trauma therapy. The formal evaluation diagnostic of mental health, individual psychological debriefing, for example, critical incident stress debriefing, or CISD. Then psychotherapy for long term. That's according to Crable and Shamsa 2015. Then these are the things that I add that we have to avoid seeing of the victims or the survivors of post-disaster trauma, like you'll get over. You're just a bit of shock, that's all. I'm not expert, but I think you should. It's not bad. Others have it even worse than yours. Stop making fuss about it, according to Drug Hisi 2022. Those things should not be said to the victims because it cannot be a help to them. Thank you so much. That's all. And have a nice evening. Again, this is Anlin Lesko. Bye-bye.